Many people having cosmetic surgeries are not happy with the results. Here's why. With the rise of social media and camera filters, people can make themselves have higher cheekbones, clearer skin, or bigger eyes, just like in anime. And when the filter shows a prettier, more aesthetic version of themselves, many go under the knife. Experts have been calling this phenomenon Snapchat dysmorphia. While Snapchat dysmorphia is not an official mental health diagnosis, scientists think it might trigger body dysmorphic disorder. Someone with body dysmorphia hyperfixates on minor flaws or even imagines flaws that are just not there. As a result, they can often spend hours of their day preoccupied with fixing their insecurities, including editing their photos and maybe even having cosmetic surgery. People with body dysmorphic disorder represent 13% of cosmetic surgery patients. And this is where we've got a problem. People with body dysmorphia will not feel better about themselves after the surgery. Instead, some may become depressed for not getting the results they were looking for, and others will fixate on another body part, entering this cycle of surgery after surgery. The reason why they don't feel satisfied seems to be because of the wiring in their brain. People with body dysmorphia have abnormal activity in parts of the brain involved in visual processing. This makes it difficult to process general information about faces, which explains why the focus is on the small details.
My hairline is so weird. My pores are huge. My nail beds suck.
And they also have unusual brain activity in the frontostriatal systems, brain regions that help control behavior and emotional flexibility. This abnormal activity was connected with how ugly patients with body dysmorphia reported viewing themselves. Many surgeons agree that people with body dysmorphia should not undergo plastic surgery. But even if they agree, surgeons are not good at identifying who has and doesn't have body dysmorphia. This has been reported in several studies. The good news is that if identified, body dysmorphia can be treated. It just happens that people with this disorder are going to the wrong doctor. They shouldn't be going to a surgeon. Instead, they should be seeing a mental health professional who can provide cognitive behavioral therapy and medications to treat the disorder. But, like with many mental disorders, people do not always know they have a mental disorder. People with body dysmorphia see small or even imaginary flaws as big problems that nobody else can see. But we need to understand that we can only perceive the world through our own eyes and have nothing to compare it with, which makes it very difficult for someone to realize they have a disorder. And this is why it is so important to increase awareness of these and other conditions so that people can get the help they need.